A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana to MBCI TV, ambapo tunabadilisha maisha by the grace of God. I am super excited to be here and really blessed that I've been able to see yet another morning. And I'm happy, that God has given me another chance to be your host today. Today we'll be having an amazing conversation. As you can see is that I'm holding a book. So today we are talking about health, but we're also talking about this particular book, which is very important. And chani cover hii hapa kidogo because I want to introduce our guest in a very good, amazing way. So I don't want you to know who we are having today just yet. Because the lady we are having today, she's not very new to us. We've had her here for a few times, not just once. And every time we've had her on air, we really have an amazing time and we learn a lot. She's a gynecologist, and if you've been to our Facebook page on MBCI TV, I know that you've seen our poster and you know what we are talking about today. But even before I go there, Karibu sana. Thank you so much for joining us today. Thank you for sparing your time and for choosing to watch MBCI TV. We value your time greatly. My name is Rachel Kahugu, and today we are here for Afya Clinic. This is a show that we talk about your health, everything that involves your health. And we do that in a way that you are able to understand. We simplify every term, every topic in a way that you'd be able to understand. Because sometimes your body is trying to speak to you, but you're not getting it. Nitatumia hii book leo sana. So we make sure that you understand everything that your body is telling you. And as you can tell is that I tried to match my outfit with the book, just for the vibe of it. So today we'll be having an amazing time. So officially, Karibu sana. Please feel free to engage with us. For that, our numbers are very open. That is 0721-105-105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. We are live on YouTube on MBCI TV official YouTube page. And of course, for that, we'll be able to get your feedback on all social media pages at Rachel Kahugu. I'll be able to get your feedback. Now, today we are having Dr. Jemimah Kariuki. Nonekana. You'll be able to read it. Okay. So today we are having Dr. Jemimah Kariuki. She's a gynecologist. We've had her here so many times. We've talked about your health as a woman. What are you supposed to do to make sure that mwili yako iko sawa? You understand your body. When you see something, you know this is exactly what's happening. We've talked about pregnancies. That was such an amazing topic. And you talked about during your first trimester, your second trimester, your that trimester, what exactly you're supposed to look out for, what exactly you're supposed to do. If you weren't able to watch, if you didn't know that we had that episode, you'd always go back to MBCI TV on Facebook and YouTube. Just search Afya Clinic, Dr. Jemimah Kariuki, and you'll be able to find us there. You'll have an amazing time watching it. Na utabarikiwa. But for today, I'd like to introduce Dr. Jemimah for the people who are hearing that name for the very first time. So you get to know who she is, and then we'll get right into the topic.
Dr. Kariuki is currently a registrar in obstetrics and gynecology, diligently pursuing her specialist recognition. Her commitment in enhancing maternal health care is exemplified through her role as the founder and CEO of Wheels for Life, an innovative organization dedicated to reducing pregnancy-related complications by addressing the critical delays in accessing maternal health care services. Through her tireless efforts, she is making strides in connecting communities to essential health care facilities. Her impactful work has garnered both local and international acclaim, and in 2020 she was recognized by the BBC as one of their 100 women, and in 2021 she was featured in Tropicals magazine's list of influential figures. Dr. Kariuki has also been honored as one of the top 500 most influential Africans, recognized in Avance's 100 most influential Africans. Additionally, she received the prestigious Uzalendo Presidential Award in 2020 and the WHO Director General Award for her outstanding contributions to maternal health. Ladies and gentlemen, please join me in welcoming Dr. Jemimah Kariuki, a true champion for mothers and visionary in healthcare innovation.
So that is who we are having in studio today. It's such an amazing time to be here. So once again, if you have any question, please feel free to ask. And for that, again, our numbers are 0721 105 105 on WhatsApp, 23814 SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. We are live on YouTube on MBCI TV official YouTube page, and on all social media pages at Rachel Kahugo. I'll be able to get your feedback. Now, today we are having a doctor who has a lot of hearts. Karibu sana. Now, today I'm not sure if I'm supposed to call you a doctor, an author, you know, like this. There's so much there, and I'm so happy to just have this conversation with you.
Thank you.
Once again.
Thank you so much.
Yeah, karibu sana.
Asante, thank you for having me, and I'm really grateful to God for this platform, for this opportunity to just talk about His children. And talk about our bodies, because I think we really need to understand our bodies. So thank you so much, Rachel, for hosting me.
Asante.
I really appreciate it.
Perfect. Now, for the people who are seeing you for the very first time, and I know that we've done an intro already, and you've done shows before, but there are people who are seeing you for the very first time, and they're wondering, hata tusikie sauti yake, you know, tujue yeye ni nani from the horse's mouth. So please introduce yourself.
Okay, so my name is Dr. Jemimah Kariuki. I am an obstetrician, gynecologist. I am a mother. I'm a wife. I'm an author. God, I'm an author. But most so, I am really just passionate about women's health and everything that pertains women's health. That is what has led me to do gynecology. I really enjoy delivering women, watching them propagate life, and being okay afterwards. I feel like the woman needs to be okay after giving birth, before giving birth. I work with them all the way through menopause and after menopause. So it's an honor, really. I think it's yes, it's a career, but it's more of a ministry to just work with God's women. Because we really carry a lot, and we are the wombs that God uses to bring on the next and the next and the next generation. So it's been an honor to serve women, and I serve them in different platforms. I have Wills for Life. Wills for Life is a foundation, an organization that helps women to understand pregnancy, to reduce the 3 maternal delays. That is when to know when to go to hospital, you know, how to get to hospital. We offer transport, and we offer it for free. And then at the point of the hospital, what to expect in terms of care. So we really connect them with the right hospitals for whatever issues. And we have a WhatsApp group for them after that. We support them, we work with them for 18 months. Most of them have gotten their second baby, then we start the journey all over again. So Wills for Life has been a movement for me, something that has been, as I said, God ordained. I really did not think it would become a movement, but God has been faithful. So now we support 2,000 women across Kenya, Uganda, Rwanda, Tanzania.
Beautiful.
And some apparently in the UAE. I don't know how they got to us, but we thank God. So we do webinars, we work with them through different topics. Over and above that, I speak a lot. I speak a lot in churches. I speak a lot across different community platforms about different matters, women's health. And those speakings and all that is what has led to this book now. So this is my book. I don't know if they can see. This is my book. It's my current last born, this one. And this book was born from questions that women ask me, either in the clinic, either in different forums about vaginal health, sexual health, urinary tract infections and whatnot. So this was an answer, because when you start seeing like so many people ask you the same question, you realize there's a gap. So this was to fill that gap. So that's me. Also I'm a mom of 2 children who are amazing gifts from God. I really love them, and I'm grateful. I'm grateful to be here.
Amazing. I love how you integrate what you do as a career with ministry. because that's really amazing. And how you said that it's not just a career, it's also ministry, it's a calling. Yeah. So you know that you're not just doing this because you're doing it because it's a calling and you love to serve the women. Yeah. So we can tell from the conversations that you have that anytime you're having conversations on air, you do it so passionately. Yeah? Story like the other time I remember okay, should I say that on air? So the other time I remember we had a conversation and then later we got into business and you're asking me, hey, now do you take care of your body? And we were getting to I'm like, Aki dog.
It's important. You need to take care of yourself. We need you alive.
Yeah. Yeah. So we are very, very happy to be having this conversation.
Thank you.
Now, today specifically, we'll be talking about yeast infections and UTI.
Yes.
Because it's a question that we've seen recurring and we've not been able to have this particular discussion. Hopefully, with time, we'll be able to talk about every topic that you've highlighted here, because you have very many topics here. In fact, you have 25 chapters. If you're able to, please get this book. And we'll be telling you how you can get this book. But I hope with time we'll be able to unpack all these topics. But today we'll be focusing on UTI and yeast infections and tell you a little bit about what we have here. But in layman's language, let me just start by, because it's all under maternal health. Mm-hmm. When you talk about maternal health, what are we talking about?
So when we specifically talk about maternal health, you're looking at, anytime you hear the word maternal, you're thinking of a mom who's pregnant.
Yeah.
So we're looking at the health of the pregnant woman. So when we're talking about women's health, we're looking at a woman, whether pregnant or not, and how their health is.
Okay.
And when we look at the health, we look at this person holistically. How's your mind? Are you emotionally stressed? Are you having any difficulties that are psychosocial, which means that generally how are you coping with stress? Because we have stresses every day. So we're looking at that aspect. We call it mental wellness. We're looking at physical wellness. You're looking at things like high blood pressure, you know, the things we ignore. How's your blood pressure? How's your heart rate? How's your hormonal balance? And we're not just looking at the reproductive hormones, because when we think of women, we think of estrogen. Yes. But we're looking at how are they handling cortisol. Cortisol is a stress hormone. How are we handling thyroid hormones, because those are the metabolic hormones of the whole body. How's your prolactin level? That's the hormone of breastfeeding. How are your levels as you're running through your day? How's your estrogen, progesterone? How are your FSH, LH? Because there's so many things that make up this particular woman. We're looking at how's your heart, how's your lungs, you know, how are your kidneys, and the different things that can go wrong in those aspects. So when we're looking at the well woman, we're looking at the woman holistically. Now, when we go into maternal health, we're looking at a pregnant woman carrying life and how is their health. Because pregnancy changes each and every system of the body. So how are those systems being changed and how is the woman navigating that, all those changes? So you find that people who have diabetes in pregnancy, but outside pregnancy they're fine. People who have hypertension in pregnancy, outside pregnancy they're fine.
So it goes away after pregnancy?
It goes away after pregnancy.
Why?
Because of the placenta. See that communication between the mom and the baby? There's a way that how that placenta attaches. If the balance is not correct, it can predispose you to a lot of hormonal issues, especially high blood pressure and diabetes. So the minute we take away the placenta, your body is able to self-regulate. So that's maternal health.
Now, it's very interesting that, and you've started by saying it, that every time we think about maternal health, we think about pregnant mothers. But no, we're talking about your body in general. So much that would happen in your body. And that's very important. Because now, as we talk about UTI and yeast infection, are we talking about a mom who's pregnant? No. We're talking about a woman in general.
Exactly.
But let's just start by asking, because this is a question that I was asked immediately the poster went out. UTI and yeast infection, is it only for women? Is it only women that are affected by UTI and yeast infection?
Yeast infection only affects women. UTI affects men and women, but it affects them very differently because of their physical anatomy. Remember, the physical anatomy of a man is that everything is outside.
Yeah.
So even if they get a UTI, it's a burning sensation, it's really rapid. They get to know about it so much faster than women. Okay. But it takes them a long time to get a UTI because it's a long journey to get to that bladder in the male body. But for women, and some of the things I wanted to show, that our tract is very short because everything is internal. So we just have a gateway to the outside. So women get UTIs much more frequently than men do, but both can get UTIs.
Okay. Now, because we're already talking about UTIs, let's start kwanza na UTI, and then we'll talk about yeast infections and what that looks like. So UTI in layman's language ni nini?
UTI is a urine tract infection. So it's all infections to do with the urine. Okay. Has nothing to do with your sexual health, by the way. Nothing to do with your sexual health. Yeah. It's just about the kidney, the ureter, which brings the urine from the kidney to the bladder, then the urethra. Okay. So when we go up from above the bladder onwards, we call it nephritis or ureteritis. So that's an inflammation of the kidney, inflammation of the ureter. But bladder downwards is called UTI. So let me show you. Can I draw?
Yeah.
Sorry.
Sorry.
I'll pick that up. Okay. So I wish we had an image, but it's okay. So this is the kidney. That you have two kidneys, you're aware?
Oh, by the way, fun fact. What show are we having? And someone said that there are people who would have 3 kidneys.
It's true.
It's very interesting.
It's true.
It's very interesting.
There are people who have even 4 kidneys. That 2 kidneys split and one kidney became 2. But it's an anatomical issue, and sometimes they have their own challenges and they get UTIs more frequently. But there are people who have 2 kidneys or 3 kidneys or 1 kidney instead of 2.
Okay. Yeah. Biologically, ama ilitolewa?
Biologically, they're just born like that. Yeah.
Interesting.
But it's good because of how embryology works. So kidney, forgive my drawing. Ureter, coming down. Bladder. So bladder looks like a bag. It's a bag, actually. It's just a bag. Something we call a trigone. And then down a urethra. The urethra of a female is 4 centimeters only. Imagine, only.
For male?
It depends on the length of the phalanx.
Okay.
So if they're 10 centimeters, it's 10 centimeters. Okay. But it's definitely longer than 4 centimeters. Okay. So this is a pathway. So kidney, bladder, ureter, urethra.
Okay.
So
maybe you can just hold it up like that for
English.
Yeah.
So kidney, ureter, bladder, urethra. Okay. So this short length, this one, is what usually gets infected most of the time. Okay. Okay. So out here is outside. It's outside. Yeah. So when someone gets a UTI, we're looking at bladder, urethra downwards. Yeah. And there are different bacteria that are outside the human body. You know that your skin has 1,000,001 bacteria. So even down there, we have bacteria that are normal there. So if there's anything that will change the normal bacteria there, then you end up getting a urinary tract infection. Okay. I had done this earlier to show you. It's this one.
Yeah.
Okay. So bladder. Ureter. So there are 3 holes. Yeah. This hole here is the urethra, the ureter, and the vagina. This will be important when we talk about yeast infection. And the rectum, or where we pass stool from, is here. The distance from here to here It's very short. So like 3-4 centimeters. So if you get bacteria from the rectum where you pass stool and it goes to the bladder to the urethra, you see how short that distance is? Then the bacteria here is what causes infections here. That's the most common cause of a urinary tract infection. That you had bacteria moving from the rectum where it's supposed to be, passing through the vagina, can give you some types of yeast infection, but landing at the urethra. Okay. So if it lands here, 100% you're getting an infection. Okay? So that's the most common cause of urinary tract infection. And so most of the things we tell women, like wipe front to back, is so that you're wiping from the urinary tract, going past the vagina towards the anus. Okay? So if you don't do that, because the bacteria on the urethral side don't affect the rectum at all. That space is really well protected. But bacteria from behind can really affect anything on the upper tracts.
So that is the most common cause of UTIs.
80%.
Okay. For men?
For men, it's usually a catheter, for whatever reason. That if they had a blocked urinary tract, like when you get older, as men get older, because they have prostates somewhere here. Today I'm drawing a lot. So in a men tract, there's a prostate here. This is where the prostate would be. The women have a smaller, almost similar gland. It's called the skin gland, but this is the men's glands. So this prostates grow bigger as age and testosterone continues for like 60-70 years. Makes these prostates grow bigger. So as they grow bigger, what do? They push onto the urethra in between. So if this and this are big and there's a pipe in between, what happens in a pipe is in between two stones. So it becomes smaller. So that smallness is what we call BPH, benign prostatic hyperplasia. It blocks that tract. So that blocking of that tract is what causes them to, one, have issues with their urinary tract, and that's why we see UTIs more in older men. And now when you try to unblock that, you put a catheter, it starts giving them infections. The other thing is that the bladder. The bladder, your whole body, every toxin you take comes out of your body in two pathways. The kidney and the liver. If it goes through the liver, it will be taken out through stool. If it goes through your blood, your kidney, it will be taken out in urine. Okay. So in effect, the urine is a store of all the toxins of your body. You understand? So if you keep something that's toxic in your body, then it's likely to give you some infection. So for example, if you know women who, I feel like going to the loo, but let me finish this. Let me finish this meeting. Let me finish this.
I have an assignment. Let me do that fast.
Faster, and then I'll go. So the more you stay with urine in your bladder, especially when it's full, you allow the bacteria that was trying to be gotten rid of to stay in your bladder, and then it starts growing. So that's how people get infections from the bladder coming downwards.
Which means you get an UTI. Just you have very good hygiene, you're not using public toilets, because I get that a lot, but you still get an UTI. And you're wondering what happens.
Because you just stayed with your urine for too long.
Or to be a woman. Or to be a woman. Now, what are some of the, before we go to how it presents for both men and women, you've talked about taking in toxins. What would this look like? Does it look like what you take? Does it look like your meals? People who drink alcohol, and let me look to you directly and tell you that it's wrong. Does Yeah. What is it about taking in toxins?
Your body, whatever you eat, will remove some toxins. Okay. So whether it's meat, there are people who eat a lot of meat and then they mix with alcohol, beer, you know. So all those proteins have to be eliminated from your body somehow, and they're eliminated in a component called uric acid. Okay, which if you take in excessive amounts, you end up with something called gout. Okay, so it could be the food that you're eating. It could be people who take excessive sugar because it will come out from your urine actually, or it will be, if your insulin is working well, it will be packed here as fat. It will be packed somewhere here. It could be the medication that you're taking. So all meds, if you take especially antibiotics, you'll start feeling like your urine is smelling very strong, and like the drug itself. So even the medications that we take come out through as toxins from the urine. It could be anything that goes through your mouth and gets to your blood will have to be filtered in the kidney. So how we help your kidney is just to drink a lot of water, so that you're helping it with what needs to be flushed out. Comes out clear. And one of the ways to know if your urinary tract health is good is that your urine is a color of close to water. So, and how we know in the hospital that this patient is very sick, there's something we call acute kidney injury, is that you start producing urine that looks like literally Coca-Cola. So it's blood stained, it's really concentrated and all that. So most people have urine that is yellow. If you're going towards orange, either you're taking drugs that have an orange pigmentation, or it's too concentrated, you're dehydrated. So sometimes we give ourselves toxins just by not drinking water, because then your body is trying to reabsorb as much water as it can, and therefore it leaves a very concentrated sediment coming out, and then that stays in the bladder for a long time as well, and then now you get. So here there's a lot of biology at play. So if you have, you know, this quencher juice, or okay, I'm not sponsored. But any juice colored that you put in water, if you put it in a glass of water, then that glass of water tastes very, like that juice glass tastes very strong. If you put it in a liter of water, it becomes dilute. If you put it in 5 liters of water, it becomes even more dilute, so much so that you may not even tell that there was something in there. So same thing, if you have anything that you've ingested, bacteria or otherwise, if the dilution factor by how much fluid you're taking in is a lot, then you may not notice it at all.
So take a lot of water. Take a lot of water. Very important. But what is a lot of water? You know, people talk, is it 8 glasses? How we talk about it?
8 glasses. If you look at a glass being 250 or 200, but 250 is usually the regular glass. So if you're saying 8 glasses, you're looking at about 2 liters of water. So we say 2 to 3 liters of water. If you're breastfeeding, you're looking at 3 to 4 liters of water, because we know you're producing literal milk.
Again, or to be a woman?
Yes, to be a woman.
Let's talk about what are some of the ways UTI presents.
UTI is very straightforward. You will have a burning sensation when you're passing urine. So either you'll have it at the beginning, in between, or at the end of passing urine, and it will feel like it literally burns you. The other thing is that it will feel painful, especially if the bacterial load is a lot. You'll feel a bit of pain. That those who have blood in urine can be different things, but that's also a sign and symptom of a urine infection. Another one is that whenever you go to pass urine, you've finished, you flushed, but you still feel like I need to go back again. That increased frequency every other minute you feel like I need to go back to the loo, I need to go. And the usual statement is, I feel like going to the loo, but when I go, it's not a lot. That's a common statement that we hear. So that's also one of the signs and symptoms of urinary tract infection. If it's a kidney infection, you'll feel pain at the left flank, behind here or somewhere here. So, or really on the corners of your pelvis, because that's where the kidneys are. So that can be really, really painful.
Also, it's not something you can ignore.
No, that one is a consistent dull pain that gets worse as you go. And please don't ignore that one, because we need your kidneys. So, and it irritates you. The other thing is that you may feel a pain here. And if someone touches you, even in the hospital, and they come and touch you, you'll feel the pain over your bladder area. So we call that suprapubic tenderness or pain. So those are the clear-cut symptoms of a urinary tract infection.
Is it the same for men?
Men, same. But it's really, really hard to ignore, because it feels like you're being burnt all the way.
Now, I'd love for us to get to see some of the what people know about UTI and yeast infection. We call this the Vox Pops. So you get to listen and just hear what people know, for us to know if we need to do more sensitization, talk to people more about UTI, yeast infection and things like this. And then after that, you'll tell us what you think about that, your view as daktari on the show. And then we'll be coming back to the discussion.
Thank you.
So let's get the Vox Pops.
Kulingana venye naelewa, UTI ni ugonjwa ile yenye huwa inaambukizwa kupitia kwa njia ya kama umeenda kwa choo chafu uweze kuitumia, na maybe ulipata ikiwa chafu alafu itumie. Sasa hapo ndo penye mimi wanaelewa mtu huwa wanapata hiyo infections. Ama pia unaweza kutana na mtu mwenye ako na ugonjwa ambaye ashakuwa infected, alafu ukienda na yeye kupitia kwa tendo la ngono, unaweza pata hayo magonjwa pia.
Body yeast infection nimesikia mademu wanaipata kwa kutumia loo, kama loo ni chafu, but sijaisikia kwa wanaume, nimesikia tu kwa mademu. Najua inaweza inakuwa transmitted, mse mwingine mwenye ako na hiyo ugonjwa akija kutumia loo alafu iache chafu, inaweza transmit kwa demu mwingine. But tunashukuru Mungu pia sisi wanaume hatukuipata.
UTI, according to my knowledge yenye nimesoma shuleni, I think inamaanisha urinary tract infection. Urinary tract infection inaletwa na vitu mingi sana. Basically inakuwa ni maybe a lot of antibiotics, ama labda putting on underwear zenye si clean or they are damp, just to mention but a few.
They are caused by bacteria. Alafu UTIs ni zile sexually transmitted diseases zenye zinatransmitiwa through sex. Yeast, tuseme something imeharibika, then unaenda unakula, sasa hiyo yeast inakuwa absorbed kwa mwili, alafu unakuwa mgonjwa.
Yeast infection, most ladies huwa wanapitia hizo yeast infection. Sometimes huwa zinakosiwa through share toilets, especially hizi toilets za hizi za poti. Hapa acha niziweke hivyo mostly.
Alright, so that is what you get on the Vox Pops. What do you have to say?
Interesting views. But one thing I've noted is that there's a stark confusion between a urinary tract infection and a sexually transmitted infection. So that's something that I think we'll be debunking. Yes, there's that worry with shared toilets. It's a significant worry. And if you go through the book, shameless plug, we talk about ways to just, go about shared toilets. But one of the common things is that there are two schools of thought. So in these schools of thought is that, one, if you need to use the toilet, please use the toilet. because I said if you hold urine for too long because you're avoiding the shared toilet, then you end up with an infection going through from your bladder coming downwards. Okay, so there are two schools of thought. That one, if you really feel like needing to go to the toilet, go to the toilet. Then there's the other school of thought that avoid the shared toilet. So my thinking would be, if you need to go to the toilet, go to the toilet, but flush the toilet before you use it. Try, if you can, to get a pit latrine or a, I don't know how to call it, the low toilets, the one that's not a WC, okay? Then if you can't find that, and it's a WC is what's available, and that's what we commonly find nowadays, flush the toilet, put some tissue on the bowl to avoid just splashing, okay? And hover. Hovering also has two schools of thought, that if you squat, you limit some urine from coming out. That can also give you issues afterwards. Or if you sit down, you will pick up infections from the toilet bowl. So again, if you can't be able to get things like sanitizers or 70%, 80% alcohol solutions, usually from sanitizers, you can spray on the toilet and then put the that toilets are really good that have like a sealant, so that you sit on top of it. If you really have, especially if you have to do number 1 and number 2, okay? So that's one option. But in nature, we used to squat, so I think if you can squat it, well and good. So I think those are the things you can. So one, put toilet tissue on the floor. You carry on tissue. This is a lot of tissue. Yes, so put the tissue on the bowl. Then flush, put the tissue on the bowl. Use the toilet. And then flush afterwards, so that you leave it clean for the next person. And then now wash your hands, because it is the handling of the, people think it's a toilet bowl, but those bacteria die very fast. It's, you've wiped your with, and then you flush. You see that flush? That's your problem. You get? Because that has actual touched the urine and then gone to touch the flushing mechanism. So take a piece of tissue and just flush with it. Then you get, then throw it as it's doing its flushing thingies. So small things that can help, and then after that just drink a lot of water, so that anything you picked up, if at all, goes away. So remember, you're putting the toilet tissue there, so that if it's splashing, the tissue is going to absorb it. So that's just the logic of it. And then you're sanitizing the bowl, so that it's just your bacteria on the floor. So not everyone has their own set of bacteria. Your bacteria will affect mine and vice versa. So that's just what you're trying to eliminate. And then washing your hands afterwards is to avoid carrying it to the next plate of food that you're going to eat, and then that causes now that cyclicity of infections. So I think that's that. And then there was something about yeast and sexually transmitted. Yeast is usually more a pH thing, but if you have yeast and you have sexual intercourse with your partner, it remains on them even if it's not affecting them. So as you get back together, it reinfects you even if we had treated you as a person. So that's why we do a lot of partner treatment. But there's a lot of infections sexually transmitted that we need to treat everyone. But they present as vaginal infections, not urinary tract infections, apart from gonorrhea, which affects men typically in the way a UTI would. But remember, for them, it's one object that carries 2 pipes. Okay, so any infections would present on the phalanx. But for women, we have 3 separate pipes that are very distinct. So a vaginal infection is not necessarily a urinary tract infection. Now,
Now that you've talked about the UTI and you've mentioned about the yeast infection, now we'll be getting into the part of the yeast infection and what that looks like. You've talked about the pH, which is something we'd like to unpack. But before we do that, if you have any question you'd like to ask about the UTIs, or maybe about the yeast infection that we're just about to talk about, please feel free to ask. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all social media pages at Rachel Kahogu, I'll also be able to get your feedback. But for now, we'll be continuing with this discussion. But immediately after break, we'll try as much and read all your questions and answer, because that is very important. Yeah. Now, to yeast infection, you've talked about the pH. Yeah. What exactly is pH? Yeah.
You've asked that, and then my head went to chemistry, the litmus paper.
Yeah.
Yeah. So pH is how acidic or alkaline a fluid is, or whatever an organ is. Okay. So if you remember in chemistry, we had this litmus paper that if something was acidic, it was red. If something was alkaline, it was blue. But it's basically how acidic or how neutral or how alkaline is a component, whatever fluid, whatever organ, whatever. So every organ has its own natural pH. Okay. Most of the body has a neutral pH. Your blood is around 7.2, 7.3 thereabout. So and why is that? Why do we call that neutral? Is that it's as close to water as possible. So if you have some organs that need to be acidic. Number one is your stomach. Because it gets in touch with a lot of food and outside areas. It has to be acidic to kill off the bad bacteria. Okay. And the fluid in the stomach is actually hydrochloric acid. Okay. Because it has the work of killing bad bacteria. Because you ingest so much when you're eating. Similarly or likewise, the vagina also receives a lot of fluids, it's like an inlet. So it's allowing the penis, it's allowing things to go into the body. So because it's allowing things to go into the body, it has an acidic pH. It's to kill off any bad bacteria that can come from outside. That's how I think about it. The rectum and the urethra are allowing things out of the body. So they are more closer to the pH of the body. They are more likely neutral. Okay. The skin depends on where you look. It just depends. It's neutral, it doesn't matter. But it's a very tight barrier. So nothing can penetrate unless an actual cut. So anything that allows things into the body tends to have an acidic pH. Okay. So the vagina has an acidic pH. The male reproductive system has an alkali pH because it's getting things out of its body. Okay. So if you're looking at something that has an alkali pH and another that has an acidic pH, that pH imbalance causes bacteria to grow or yeast to grow, or you get. So for example, when we are shedding blood every month, blood is neutral or close to neutral, and it will come out through the vagina. So the pH of the vagina at that time is going to be elevated. That's what we call a pH change. So it's not unusual that after you get your menses, you have a discharge afterwards, because the body has moved from its normal acidic pH to this close to neutral pH. So when we talk about vaginal balance, we look at that pH, and what maintains that pH is a normal vaginal bacteria microbiome, something we call lactobacillus. So whenever we take antibiotics for any other reason, it doesn't know where it's supposed to. Okay, it knows, but it will kill all bacteria, including healthy gut bacteria and healthy vaginal bacteria. So for where I am concerned, that is lactobacillus. Okay. So if it kills off that good bacteria, then yeast, which is around that area, will start growing, and then you end up with a yeast infection. Okay, so that's why I say when you have a yeast infection, it's more likely a pH shift.
Yeah. You've explained it very well, and especially the part where you take antibiotics. You know, most of the time we get this question, after my P's I have yeast infections. I took antibiotics rather, and then I had a yeast infection, and you're wondering, what's going on? Yeah. So it's really good that you've been able to explain that very well. But again, for the people who are wondering, I know something hasn't been okay, but what's going on? Maybe let's talk about how does yeast infection present, so that we know if you have any question, and I know that's going to answer a lot of questions that are coming in. How would you know that in yeast infection, this is UTI or this is something different?
Number one, when you have a discharge, it does not equate a UTI. People get a yeast discharge, and then they go get antibiotics to treat the urinary tract infection, and then they end up with worse discharge. Okay, so a discharge it can be white, it can be green, it can be yellow. It can be brown, it can even be red. So a discharge is any fluid or any, I don't know how to say discharge without saying discharge, but it's a fluid material that's coming out of your vagina. And you'll notice it as a stain on your inner garments. Okay, so the body itself has its own normal or neutral discharge, which is usually very clear or white, but creamy white, but more so clear. So depending on where you are on your cycle, at the beginning of the cycle, it has a particular consistency. During ovulation, and for people who use natural means of family planning, you'll find a long stretchy discharge, creamy, and you can do this, and it's very clear. That tells you that you are fertile. Okay? Avoid everything if you don't want a baby. If you want a baby, that is your time to shine. Anyway, that's
the time of ovulation.
Yes, that's around the time of ovulation. After the ovulation, it becomes scanty and minimal. Again, shameless plug. If you look at the book,
I'm actually on that page.
It will guide you and what to expect and what to anticipate on particular places. So that's a normal discharge. When you say normal discharge, that's what I mean. It's cyclical. At the beginning of the month, it's creamy white, very minimal. During ovulation, it's stretchy and clear. After that, it's a bit, it's not as stretchy. So you'll do this and it will katika. You'll do this and it will, And then that tells you now you're in your safe window and all the way till ovulation, up to menstruation. Okay. Now, when it comes to yeast, think about it as milk. When you leave milk to stay for a while, it goes bad. We call it mala. Okay? So it will have that smell of mala because what makes mala go bad is yeast. You understand? So it's a normal commensal in milk, but if it's left for long, it overgrows and then it becomes mala. So it will have like a cheese-like consistency. For those who don't know cheese, it looks like mala. It's thick, it's white. You can flick it off from your panty. You literally can flick it off from your panty. And then if it continues, because it's a living thing, it becomes very itchy. So you find you're itchy along your labia, you're itchy around that area. It's very, very itchy. And then it has like milk that has gone bad smell.
Yeah.
So it smells very cheesy, for lack of a better word.
Yeah.
So that is yeast.
Okay.
And it's really white, creamy, thick. Your own discharge may be white, but it's not thick. This one is very, very thick.
Okay.
Yeah.
Okay. I hear you. Now, I see on this page where you're looking at why do I get recurrent yeast infections, you talk about high sugar diets. What does that mean? Ukikula high sugar diet, you'll have recurrent yeast infections.
What was soda?
What were chocolates?
What were chocolates? What were cakes? Yeah, our bodies are not meant to have high sugars.
Yeah.
We were not, our natural diet did not compose of processed sugar.
Yeah.
And sugar is a good fodder for yeast. So if you have a high sugar diet, then your body therefore will have a predilection. It will feed off the bad bacteria. It will feed off the bad yeast. Okay. So basically that's it. It's food. It's food for cancer. It's food for. That's why when you have diabetes, we tell you avoid sugar. When you have cancer, we tell you avoid sugar. When you have yeast, we tell you avoid sugar. Just avoid sugar.
Yeah.
I think every time I come here, we talk about avoiding sugar
and take a lot of water and exercise.
It's the same thing.
Okay. Conversation. I'm usually very sure by the time we're finishing a conversation, takomesema kunywa maji, avoid sugar, and exercise. I'm like, okay, doc. Okay.
Same message, different topics. Yes.
Okay. Now, is it just sugar or it's also junk foods, fatty, what were chips? Are they safe?
It's a difficult question, but food is broken down to glucose. That's just how you need to think about food. Food is broken down to glucose because glucose is the main component that the brain feeds on. Okay. It's also broken down to amino acids, which are proteins which build your body. Your body is made up of amino acids, which are protein blocks. So chips, which is potatoes, is made of starch, which is sugar. It's just glucose and galactose. Okay, so when it's broken down to its element, it will go down to a lot of sugar at a high rate, and then it's oily, and then oil has its own different issues. Okay, so cholesterol and whatnot. So when we talk about high sugar diet, it also entails things that when they're broken down give you high sugar. And remember, when it's broken down, it's not broken down to how can I say, complex sugars. I think they call complex sugars. For example, yam. Yam is a complex sugar. It has to be broken down like 4 times to get to that glucose, which means even at the point of storage, it has made your body work for it. So it has given off a lot of energy as it's being stored. Vegetables, for example, as they're broken down as complex sugars. So starch is not a complex sugar. For example, maize is not a complex sugar. Potatoes, they're not complex sugars, and they're not our natural diet as Africans, by the way, which is why we don't know how to make them other than as chips, as mashed potatoes, bus. For the people where it's native there, you'll see that they have 65 ways of making these potatoes. Okay, but for us, because it's not our native food, then we don't know how to process it in a way that it doesn't become harmful to us.
Okay.
Yes.
I hear you. Now, in the interest of time, we're going to be taking a very short break, but we'll be coming right back to answer all your questions. I see we have questions coming in about people who say they're seeing different discharge. We've seen a question about menopause. And that's something that's very important for us to talk about, because as you were starting on a chapter on this book again, we've talked about menopause, and I feel like menopause is a topic that we don't talk about as much. So we'll talk about, do men get to the stage where we say menopause, or is it just women? And for women, what does that look like? How do you know this is what is happening to my body? I'm not losing my mind, I am okay. Yeah, so we'll be talking about that. So if you have any question, please feel free to ask. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. But for now, we're going to take a very quick short break and then we'll be coming right back. This is Afya Clinic on MBCI TV.
MBCI Television, transforming lives.
Across the valleys and the hills of Ngong in Kajiado,
O land of Kenya,
a cry is rising.
We command the land.
A cry for healing.
We release the land and the people and the resources. We dedicate them back to our God.
A cry for revival, the land and for the people this October. Missions to the Body of Christ International MBCI, in partnership with Kajiado Northwest Clergy and Gospel Ministers, invites you to a 7 days of prayer and word festival. The Healing of the Learned Prayer Conference at Ngong Stadium inside the mega tent, starting from Monday 29th September to Sunday 5th October 2025. Ministering Apostle John Kemani William and other choice servants of God. Our land is good and pleasantly situated, yet it's unproductive and has been hindered. But now a time of healing has come, a time of restoration, a time of revival. Come, let's call on the Lord together. The conference will run daily from 9 a.m. to 6 p.m. with a morning devotion every day from 5:30 a.m. A glorious Friday cashier from 9:30 p.m. and the grand climax rally Sunday at 2 p.m. will be live on MBCI TV and MBCI Radio and all our social media platforms. This is an interdenominational gathering, free and open to all.
Nikamilishe wimbo kwani ni jambo.
It's about to go down.
Lila Yesu asirani wesa.
Kwani ni jambo.
Lila Yesu asiloli wesa.
A proper coffee pot, proper. A proper coffee pot, proper. Rudia mara tatu mbio mbio.
It's about to go down.
A proper pot.
Maskini hana?
Ana chochote.
Eh?
Maskini hana chochote.
Haba na haba.
Shut up, everybody. Listen.
What?
What is that?
Utakwambia mamangu kila kitu, mbona itatosha? Wewe utangazia watu, si ndio? The moment you speak to her, she argues. You can't tell her to do something and she does it. She must argue.
This is my husband. My head, apparently, he doesn't listen. He calls me useless. Just jumpia mtoto. This one is on another level. some good news. Some good news.
Gani?
Some good news.
Cha kuneka na wasiwasi. Please, hebu niambie. Niambie tu celebrate.
When the ground moves, only strength and precision can get the job done. At Rift Valley Heavy Machinery and Professional Training Institute, we don't just move the earth, we move possibilities. Equipping professionals with world-class training, innovation, technology, because every project demands expertise. So, are you ready to power up your career and take control of your future? We train you to operate all kinds of machinery, shovels, bulldozers, excavators, graders, rollers, and many more. At Rift Valley Heavy Machinery and Professional Training Institute, you get more than just skills. You learn basic mechanics, plant mechanics, first aid, defensive driving, and even take refresher courses. We also offer courses in hospitality, cosmetology, ICT, cottage industry, mechanical and electrical engineering. And guess what? New students get a 10% discount. We conveniently located in Subukia along Nakuru-Nyahururu Highway. Call us on 0707 539423, 0707 539423, and start your journey to success today.
Welcome to Goshen Medical and Technical College Thika, where dreams become reality and futures are empowered. At Goshen, we offer a wide range of courses in both medical and technical fields designed to meet your aspirations. Medical courses such as clinical medicine and surgery, perioperative theatre technology, orthopedic and trauma medicine, health support, community health, nursing, and many more. Our students receive hands-on experience through industrial attachment, which is organized by the college to ensure valuable technical skills. Goshen College is conveniently located at Thika Makongeni, right off Garissa Highway behind Leather Industries. For more information, contact us on 0750 264 044.
MBCI Television, transforming lives.
We are back. Thank you so much for staying. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. Thank you so much for tuning in. Thank you so much for staying. If you're just joining us, this is the place to be. Today we are here for Afya Clinic, and I'll show you this book so many times today. Today we are here for Afya Clinic, and we are here with Dr. Jemimah Kariuki. As we told you, is that on Afya Clinic, we talk about everything that affects your health, because we need to be very healthy. God has blessed us, but if your body is not functioning right, you might not be able to do that job that God has blessed you with. You might not be able to take care of your kids, of your husband, your wife. So it's very important for our bodies to be well. And today we have our book, and the title of this book is What Your Body Has Been Trying to Tell You and No One Ever Explained. Isn't this a problem we all have? That's why we use Dr. Google, Dr. ChatGPT, and they give us very funny answers, and we get misdiagnosed. That's why we have this book, and it has been written by Dr. Jemimah Kariuki. So today we have in studio a doctor, an author, a mother, a wife, and an amazing woman of God. Yeah, karibu sana.
Asante sana.
Thank you so much for being here.
Thank you for having me once more.
Yeah. And today we're very happy to be talking about these particular topics. Today we're not talking about one topic, and it's because this is something that affects a lot of people. We just don't have a space where people can openly ask about, I feel this is what's going on with my body. Also would say there's a lot of stigma around issues of maternal health, and you don't get a space where people would ask this openly, especially for men. Correct me if I'm wrong. Men feel like, I can't be talking about these. You know, we've at least made it comfortable for women because of the pregnancy. And, yeah, but for men, so if you have any question, you're a man and you're struggling, please feel free to ask. feel free to ask and we'll be answering your questions.
Yes.
Karibu sana.
Thank you.
Once again.
Thank you.
Yes. Now, maybe before we go into the questions, because I see we have so many questions, before we go into the questions, tell us a bit about Wills for Life.
Oh, wow. I did not see that coming. Wills for Life is a women-led, doctor-led movement. We thrive on making sure that women know when to seek decisions, when to go to hospital, and how to go to hospital. And we like that done very rapidly. So it's a movement that started during the COVID-19 pandemic. If you remember, there was a COVID-19 pandemic and there were curfews. So women could not get to hospital for their deliveries and whatnot. So we created a system where if you call 1196, even now, by the way, if you call 1196, then you are connected to a doctor, a consultant, by the way, who then listens to your issues and gives you sound advice. So we really plug on to telemedicine. But if we find that there's an issue that cannot be virtually solved, then we transfer you to hospital, either through cab or ambulance, and to the right level of hospital. So sometimes funding is an issue and we're not able to transport everyone for free. However, we'll guide you that this is the hospital that you need to go to so that you can get help. And if you really want to support us, by the way, please do. That is something that helps very many women, and we aim for it to be really as free as possible. So we have a WhatsApp group. I think I'll leave you with my number so that any woman who is pregnant, has been pregnant recently, has a baby below 18 months can plug onto. So on this WhatsApp group, we give you webinars, we ask questions. It has very many doctors, gynecologists, pediatricians, nutritionists, diabetologists. We even have an orthopedic, dermatologist. We have everyone there so that if you need to be guided, and really what's important for me is a peer-to-peer support. We have women who we call super moms. They've gone through pregnancy, they've gone through the thick of it, they have come out on the other side, they're happy. So when you talk about, I'm struggling with weaning, I don't know what to give my baby, they have recipes ready. They know what to do. They know what to do. My baby is teething, it's painful, I don't know what to do. They'll tell you about to do cold carrots. It's so much so that now, we give cold carrots. So much actual carrots, like a cold blanched carrot. So you boil carrot a bit and then you let it remain cold, and then you now give the baby to bite instead of buying a teether. So that was a natural teether. And the good thing is that it's healthy. It's healthy because babies tend to bite on everything when they're teething. So that biting on everything is what gives them diarrhea. So as they're taking a stone, because they're trying to scratch. But if you give them a carrot and it's clean and their hands are clean, they don't get infections, and therefore you avert the diarrhea and whatnot. So anyway, we have super moms who will guide you on all these topics, and we're there. So in case we hear something that's not medically sound, we'll come in and tell you, no. Here, let's go this direction. So that has been growing. It's grown now. We have workshops for pregnancies, we have workshops for fibroids and all those issues, which is really, really amazing. We have a YouTube page, Wills for Life by Dr. Jemimah. If you need a consultation, and if you are abroad and you're not able to join us on WhatsApp, the community is also on a platform, Wills for Life app. It's available on Android Play Store. It's available on iOS if you're an Apple person. So it just Google Wills for Life. Rather, just put in Wills for Life. And the beauty of it is that you're able to connect with a doctor across any country. So it's there, it's live, we have community, you can ask your questions, you can see what we've been discussing all through. So that just was to open up for everyone else. And then the other thing that is beautiful about Wills for Life is that we are seeing women grow. I remember one of the women we supported with transport initially, she's now on her third born.
Okay,
yeah,
that's good.
And she's doing really, really well. We have women who can be quite destitute, having not a lot of, or just life happened. They're okay, but life happened. So we also do what we call, it's not a declutter, but if you have clothes for babies and if you have things that you can give out, maybe your baby had tried, formula has a short expiry, but if you have like food items or things that you want to give out to someone who, a pregnant mom or a mother who's delivered, who's struggling, especially with clothes, then we receive them and we give them for those who are needy. So that's why I said it's just
a community.
A community. Wills for Life is a community, actually.
It's really beautiful.
Okay.
Now, I'd love for us to look at the mythbusters before we go into looking at the menopause. Also, please give the, is it a number or the till number for the people who would like to support? Because you've mentioned that for Wills for Life, you give transport for free for the mothers who need. You help mothers who are pregnant, who just got their babies, and they can only imagine how expensive that would be. So there probably would be someone who's feeling, I would want to support one mom. Maybe with transport, whatever that is. Do you have a number that you'd share?
Yes, I do.
Yes, please.
I'll give it to all of you, but it's pay bill 407-8129. I hope I've got that right. 407-8129. Let me just confirm that. And the account is donate. Just donate. And we use that to support as many women as we can.
All right.
So you confirm that so that I don't lie to you all.
About the pay bill.
About the pay bill. So it's 407-8249. Yes, 8249. Yes.
Perfect. So that's it, and then let's get to take a look at the mythbusters to just debunk some of the myths that surrounds issues of yeast infection and UTI. And the first myth is that only women get yeast infection.
I think we spoke about this one. No, it's actually true. Men will have it, but it won't affect them. So,
Okay. And the second is that drinking cranberry juice cures UTI.
Doesn't cure, but it helps. Cranberry juice is alkaline nature, and urine is alkaline nature, so it's that pH thing I was talking about. So it's one of the natural methods to just balance yourself.
On the other one is that yeast infections are always sexually transmitted.
False.
We've talked about that. UTIs are always cured by or caused by poor hygiene. There's this, but we've talked about it.
It's not poor hygiene only, but because, for example, staying too long without passing urine, is that poor hygiene?
Not really. Okay. And then the last one is that eating sugar directly causes yeast infection.
Contributes,
yes. Not causes, but contributes.
Yes.
Hapo imeguza wengi. Oh my goodness. Guilty as charged. We'll need to do better there. We'll need to do better there. Okay. Now let's talk about menopause. And for the question that I'll ask is directly what you've answered here. And what do you expect? What are you supposed to expect during menopause? I see people who talk about feeling dizzy. What do they call it? There's like the sweating too much. You talk flashes?
Hot flashes.
Hot flashes. Is it normal? What do you expect?
Menopause happens in many ways. Menopause is a reduction in your estrogen component, the estrogen that allows you to ovulate, and it signifies that the egg reserve that you had has depleted. There are people who go through premature menopause. We call it premature ovarian insufficiency. Someone who's around 30, 35, getting into menopause. So basically, it happens around the age of 45 to 55. There's a 10-year period where your ovarian reserve goes reducing. And one of the ways that we know you're getting into menopause is the hot flashes that you're talking about. And that's just because estrogen is responsible for thermoregulation, and when it's depleted, therefore your body may not be able to correctly thermoregulate itself. So you get a wave of heat. So that wave of heat is what and you can be talking and then all of a sudden like you have paralyzing heat. So that's a hot flash. It can present with vaginal dryness. It can present with immunity reduction. There are people who know they're getting into menopause because their periods become irregular. So initially, if you have a 28-day cycle, it becomes 21 days, then 18 days. So you'll hear, I'm having my menses like twice a month, then they'll go to thrice, thrice a month is abnormal, but twice a month, and then 3 times a month, and then it does that for like 4 or 5 months, and then they tell you, I've not gotten my menses for this month. Then I didn't get it for 2 months. Then I got it. It was erratic. So that erratic period is an area where we call perimenopause. You're not yet in menopause, but you're heading there. So that perimenopause can last a good 2 to 3 years, and it's where everything just breaks down. If you're not careful. So you find in hormonal irregularity, that period irregularity, you find the hot flashes, which is the main complaint. You find night sweats, like your whole bed sheet is just drenched in water, again because of that thermoregulation I was talking about. So the night sweats are quite common in menopause. Sex can become painful because of vaginal dryness. Moods, oh my God, moods from here to Timbuktu, because you're not understanding your body. So it's a lot. It's a lot. I think it's worse than a pregnancy, if you ask me, because at least pregnancy has a 9-month period. This is a 2 to 3, 4 years. You don't know what, So that's menopause.
So is there anything you can do to make it a bit simpler for the people who are getting into menopause, or that's just it?
My suggestion would be, one of the main things that you need if you're going through menopause is reduced stress levels. Which is the hardest thing to say, because at 50, 55, between 45 and 55, you're at your peak. Business-wise, you're at your peak. You're the CEO, you're the director, your babies are now big, they're joining school, you're paying university fees.
For sure.
You are at the peak of life. My father would say that he says there's a sunrise and then there's a sunset, and you're up there. You get. So I'm going through the downward slope, as he likes singing it. But you're at the peak. Therefore, stress levels are high. But if you're able to maintain a calm state of mind, then that's a really good place to be. Number 2 is exercise. And I knew Kahugo would ask me something that would tell us about exercise. But exercise. And why exercise? Because it helps with your dopamine levels, which is a feel-good hormone. And because you're going through hormone depletion at a very rapid rate, if you have feel-good hormones, then it helps. Weight reduction. People, this is the only place, by the way, where if you are on the heavier side, it's helpful.
Oh, really?
Because the central obesity is that fat is converted to estrogen, which reduces the effects. Or you get. It's the only time. But I am not saying please, I'm not saying, because what happens is that you lose the protective effect of estrogen. Therefore, it's very easy to get high blood pressure. So if you have high blood pressure and obesity and cholesterol, you are a recipe for a stroke. You get. So exercise and diet. So if you have an estrogen, how can I say, supporting diet, it can help. So, for example, most of the drugs we give, even the supplements we give, are things called phytogens, which are estrogens that are made from nature, from yams, from tubers, from, you get things like ginseng, which is a neighbor or a cousin of ginger, so ginseng, they are phytogens. So if you incorporate those in your diet, then also really, really helpful. Which is why I keep talking about yams, if you ever listen to me. So that's also really important. So I think if you get those right, exercise, calm state of mind, and the phytogens in diet, then you're okay.
Perfect. And at this point is where we get the segment which is healthy living. I really try to get to a point where you'll speak about water, exercise, and diet in the same sentence, and get to talk about healthy living. So let's take a look at that particular segment where we get to look at why is it important for us to live healthy, and what exactly are you supposed to do to live a healthy life. And then after that, we'll come back and continue with this discussion.
Good morning and welcome to Afya Clinic, your trusted source of healthy tips for a better life. Today we are talking about two common conditions that affect many people, especially women: yeast infection and urinary tract infection, UTI. Yeast infection is caused by an overgrowth of a fungus called Candida. It commonly affects women, though men can also be affected. The main symptoms include itching around the private area, unusual discharge, redness, and discomfort during urination or intimacy. Some of the main triggers are wearing tight, non-breathable clothing, poor hygiene, use of certain antibiotics, uncontrolled diabetes, and hormonal changes. On the other hand, urinary tract infection or UTI happens when bacteria enters the urinary tract. This can affect the bladder, urethra, or even the kidneys if left untreated. Symptoms include a strong urge to urinate frequently, burning sensation while urinating, cloudy or strong smelling urine, and sometimes lower abdominal pain. So, how can we prevent these infections? For yeast infection, wear breathable cotton underwear, avoid using harsh soaps or douches, and maintain good personal hygiene. Reducing sugar intake also helps because yeast feeds on sugar. For UTI, drink plenty of clean water, don't hold urine for too long, always wipe from front to back after using the toilet, and urinate after intimacy to flush out bacteria. Now, what should you do if you suspect you have a yeast infection or a UTI? Don't self-medicate without guidance. Over-the-counter antifungal creams and antibiotics exist, but it's best to see a qualified health provider for proper diagnosis. Untreated infections can become serious. For example, recurrent UTIs may damage the kidneys, while untreated yeast infections may spread and cause more discomfort. Yeast infections and UTIs are common but very preventable. By maintaining good hygiene, staying hydrated, and seeking timely medical care, you can protect yourself and live a healthier, more comfortable life. That was today's Healthy Living on Afya Clinic with me, Sylvia Wanja. Remember, your health is your greatest wealth.
Perfect. That was amazing.
Yes, amazing. I feel like everything we're talking about is summarized. Good job.
Perfect. Now we'll be getting to read some of the questions. And we see a lady here who's asking, what causes ovarian cyst and what can one do? I'm in menopause.
Okay.
Ovarian cyst is something totally different.
Oh yeah. Ovarian cyst is, it can be physiological. A cyst is a bag of water that is in the ovary. There are different types of cysts. Cysts that are physiological are those that, for example, when you shed an egg, it remains as a corpus luteal cyst to support the pregnancy, if at all. And then if that does not regress, it leaves you with a physiological cyst. It goes away 2 to 3 months, usually has no issues. We have dermoid cysts, which are cysts that have a benign tumor that have hair, teeth, and whatnot. It's called it's one of the dysgerminomas that now requires, we can observe, but if it's higher than 5 centimeters, then we usually remove them. We have other cysts that are like endometriosis, which is bleeding into the ovary because of endometrial tissue within the ovary. As they continue bleeding every month, you end up developing something called a chocolate cyst. It is associated with painful periods. It's associated with painful coitus. It's associated with painful ovulation, so pain. So endometriosis is a really big topic by its own. But that's also a type of cyst. It's called chocolate cyst. So cysts are there because of different things. If you're in menopause and you have a cyst, that is really important to be evaluated by your gynecologist, because cysts in menopause, more likely than not, tend to be of a tumor-like origin, so whether benign or otherwise, and we need to do something called an RMI, risk for malignancy index, to rule out that it is not malignant. And we typically remove those particular cysts, especially if large, and if they are bifocal or showing some signs on ultrasound that tell us that this one could be malignant.
Okay. On the same, I think the issue about cyst is something we also need to unpack. And I know that we've talked about cyst before. But I see someone else who's asking about is ovarian cyst and appendicitis correct? Coefficients categorized as UTI. What's the difference, especially if you're diagnosed with both?
Okay, so three different diseases. So a urinary tract infection is an infection of the urinary tract, whether the kidney, whether the ureter, whether the bladder, whether the urethra. That's a urinary tract infection. Then we have appendicitis. Appendicitis is an inflammation or an infection of the appendix. That is in the gut. So an appendix is one of those vestigial structures. We say that we don't see their use in the human body, or we evolved beyond the appendix, but it retains a lot of, remember those dirt we were telling you the toxins are not good? It retains a lot of them. So with time it can get inflamed and get infected, and chronic inflammation gives you an infection or a site for bacteria to grow. So appendicitis is different from UTI. A cyst that is ovarian is a cyst in the ovary for the reasons that I talked about before, typically hormonal. So if she's been told she has all that, those are three different conditions, but it does signify that she's going through a highly, how can I say, that her body is going through a lot of inflammation. That if she's having an appendicitis, a UTI, and a cyst at the same time, it does point towards a highly inflammatory body system, and she needs to work on her inflammation. So that is less, the foods that are anti-inflammatory, there are drugs that are anti-inflammatory. It can also signify a rather high stress level. If I look at it from a psychosocial point of view, but they typically need to be addressed. Of the three, the most urgent is the appendicitis, because if it's inflamed, it has to be removed surgically, or be given high dose antibiotics that can also cover for the urinary tract infection.
I hear you. And then you have a lady here who's saying, I'm 2 months pregnant and I'm so stressed, I need help.
Oh, hi, congratulations, whoever you are. Pregnancy is not a disease. Pregnancy is a gift that God has given us to be able to propagate our legacies through children. It can be difficult, especially around the 2-month mark, is where you have nausea, vomiting, you know, you don't want to eat, every smell is hitting you, but your body trying to regulate the high hormones that are hitting it. So please reach out to us. We can put you in the Wheels for Life community. 0769 777 367, and we can add you onto the group. the group people contribute 100 a month. If you're not able to, it's fine. As we said, people donate and you're able to still accommodate. But please reach out. But it's not a problem. Pregnancy is a beautiful thing. I think we spoke about pregnancy at length. I love being pregnant. If I could, I'd be pregnant every year. But economy.
There's that as well.
Economy, and that I'm a CS mom. However, it's not a problem. And if you're young and the problem is support, there are different channels, ways to talk to your mom, ways to talk to your husband about how to support you. If the finances are the issue, then 9 months is a long time, 7 months now is a long time to kind of get things in order, as long as you have the right support. And the pregnancy is sacred, so even from the point of hospital, if you have shisha, Shif and Shah, they'll support you through the pregnancy. So just reach out and we'll guide.
All right. So please take the number again, so that for her and anyone else would want to join the group, they'd be able to reach out.
0769 777 367.
Perfect. She's saying, hi, I just clocked 50 and I have been having problems due to premenopausal issues. Although still I have my menses every month. Sometimes I get an urge to scratch myself down there. I think it's because of dryness. And I said, sexually with my husband, it's becoming very painful and I have a bad experience for me. I don't know what to do. Please help. So she's talking about premenopausal issues.
Perimenopause.
Yes.
Yeah. So if perimenopausal, which means it's around that season where your body is depleting of oxygen, of estrogen. The best way to deal with vaginal dryness is first to rule out that it's not infective in nature, because one of the things that can really deplete the lubrication down there is an infection, especially if you're feeling itchy. And so itchiness and that dryness can sometimes tell us you have things like bacterial vaginosis or a mixed vaginitis. So it would be important to see your local gyna just to have a speculum done and check whether you're getting this or not. If it's perimenopause itself, then we have things like vaginal creams that we apply on that area, but they're highly sensitive. You need to be directed by your doctor on how to apply it, otherwise it can have repercussions. However, we do have vaginal creams. During intimacy, I would really suggest you use lubrication, extra lubrication in the ways of KY jelly, Smart Gel, and any other lubricant. Again, plug to the book. You can get that information there.
The book.
So if you're having that type of pain and because of dryness, KY jelly is really important to help in reducing that friction, because the vagina isn't able to do it for itself, and the creams. So there are medications that can be used to help her.
Okay. All right. Anasema, hi, I have been experiencing greenish discharge. I'm married and I got treatment years back, whereby I went through a urine culture examination. What can I do to get out of this?
Again, a discharge is not synonymous to a UTI. Therefore, we don't use a urine sample to look for a discharge. What we check is a high vaginal swab. So that discharge, we take it, it's taken to the lab, and that is cultured to tell us what discharge it is. Green usually is trichomoniasis, but it could be other things. Okay, so if it's green, if it's fishy odor, if it's smelly, typically it would be more likely dry. But it's important for it to be cultured, and then it needs to be treated, and it needs to be treated plus with the partner, because as we said, if you're having intimacy with your partner, then when you meet again, you reintroduce the disease. And remember, some of them don't have symptoms, so when you ask them, they'll be told they're fine, and then we send you to the clinic. You come, they do a urine culture for your husband, it comes back normal, and then you're told he's okay. But it usually reintroduces the infection.
Okay. What about pregnancy? How can I know the difference between a pregnancy discharge and a pre-period discharge?
A pregnancy test.
Yeah, pregnancy test.
The easiest way to know whether this is a pre-period discharge or whether this is a pregnancy. Pregnancy typically doesn't have a discharge.
Okay.
There are very few people who will get some slight spotting when they're pregnant, and that's usually called an implantation bleed.
Yeah.
But the best way to rule it out is just to do a pregnancy test, typically about a week after you've had a delay.
Yeah.
So it should be positive by then.
Okay.
But if you really want to be specific, there are blood tests that can be done before you even get your menses or in a 1 or 2 day delay.
Okay.
Yeah.
Maybe the last one, in the interest of time, nasema hello, good topic. Nasema ikiwa ulipata STD more than 20 years ago na hukupata medication poa, unajikuta upati watoto, does it mean, okay, I don't get it.
I get
yeah, but I think the question means, would it be he did something wrong? Because anasema alikuwa na STD more than 20 years ago, hakupata medication poa, and now he's unable to get the kids.
Okay, so a sexually transmitted illness, if it ascends to the reproductive organs, so where that be the tubes, the uterus, the ovary in women, in men it would be the prostate, the testicles and whatnot, it can cause scarring. And that scarring is what we call pelvic inflammatory disease or PID.
Yeah.
And that scarring is a lead reason or among the lead causes of infertility, especially in women. So if you had things like gonorrhea, if you had chlamydia, and they're not well treated, then it is not surprising that now you're struggling with infertility. Yeah.
Okay. I hear you. Now, so the solution to that is that get treated.
Get treated early.
As soon as you can.
Get treated early. When you start seeing the symptoms, the discharge, the smell, the pain, especially if it's coming with pelvic pain, because that tells you it's gone further up. It needs to be treated and rather rapidly and with very effective antibiotics. And then after that followed with probiotics. So PID is a really big problem that we face, especially in the gynae world, because you get a discharge, you go to the pharmacy gives you the first drug they know, and then it doesn't clear, then by the time you're coming to us, you're really sick. So when it's acute, we can treat. When it's chronic, we're dealing with fibrosis. So fibrosis has to be opened up surgically, and half the time you're not sure it's going to work. So that is the main problem with PID and infertility.
Okay, perfect. So for the people who have more questions, maybe do you have a number they'd call?
Same number, 0769 777 367. It's our work number.
Okay.
So I would advise to WhatsApp or text, and then we'll get back to you. But if it's a really burning question, please do call. We'll still reach out.
Yeah. Okay. Now, about this book, it's such an amazing book, this particular one, hope you can see it. And the title of this book is What Your Body Has Been Trying to Tell You and No One Has Ever Explained. It's by Dr. Jemimah Kariuki. And we've talked about so many things in this book. As maybe you can tell you might not be able to read it from here, but I'd advise for you to get the book and then you can read it, but I'll just read. A few of the topics that I've seen, we have so many questions around, is what is normal and what is abnormal, understanding how your vagina works. A lot of topics here about yeast infections. Why is it itchy sometimes? Why do you feel like you're itching sometimes? Urinary tract infections, what we've been talking about, which is the UTI. We talk about how to prevent fibroids. Why am I leaking urine and what can I do about it? A global perspective about your vaginal health, your everyday guide to a healthy vagina. You talk about what you'd eat to nourish your vaginal health, becoming a guardian of your own vaginal health. Miss Mavzuri? Yeah. And so many others, as you can very well see in this particular book. So I'd advise for you as a woman or as a husband to get this for your wife or your daughter. This would be very, very important. So it literally has everything about, almost everything about maternal health. Right? Yes, almost everything about maternal health. And so if you'd like to get it, please guide us on how they'd get it.
Wow. So the book is on Amazon. You can search for www.amazon.com. For the online guys, you know nowadays guys are all online, but for the online guys, what your body has been trying to tell you, on Amazon.com, it will bring you to the book. You can read it online and you can have it paperback. So that's across the globe, because I believe we are a global community. So you can get it, and they can even print and bring it to you from Amazon. In Kenya, if you're locally available, we can get it in Nairobi at Stamo. We have rented a space there that you can get the book. Once you just get there, they'll give you the book, pay through the till number, and then you'll be handed over a copy. The other way, or the other means, is to get it directly from us or from me for your signed copy. So you can pay through our till number. We had shared it earlier. And I need to get it. Yes, please. So you get it through, you just pay through the till number, and you text us on the number 0769777367, and we'll deliver it across the country. We've gotten this book to Uganda. I'm so happy because it's a month since inception, so I'm really, really proud of that. And typically you just pay for the courier services, so whether it's the matatu or the whatever, so it's like 200 bob, and it should get to you. So that's how to get the book for now. As we get it to the bookshops. So for Nairobi, Stamall at Stamall A22, you can get the book through there, and you can send it to our till number. We'll deliver it to your houses, and you can get it on Amazon.com for your paperback copy.
Perfect. So perfect. And the till number is 6719238. 6719238. How much is it for a book?
1,000. The book is 1,000 shillings.
Yes, 1,000 book for
1,000 shillings. And you can also come to us directly through social media handles. Our social media, for this one, it's just me, Dr. Jemimah Kariuki, across all social media platforms, or through the Wills for Life by Dr. Jemimah. DM, we'll still get it to you. Yes.
You know, the epilogue is really amazing, and it's such a heart-to-heart conversation that you have here. So if you get it, please, it's very long. I might not be able to read it in the interest of time, but if you get it, I'd advise. Everything else here is amazing, but I would advise start from the epilogue. It's on page 87, and I don't want to start reading it because I'm going to you know, but it's really amazing. Maybe you can just take a look at it. You might not be able to read the whole of it from there, but it's really long. It's not like really, really long. It's what, two pages? So it's page 87 and 89. Okay, so please try. Can you see it? Okay, we're good. So this is the page 1 of the epilogue, and then this is the page 2. So make sure you get a copy. This is it. Get a copy and read the book for yourself. It's gonna be amazing. Okay, so that's it and done. Thank you so much for being here. Thank you so much for tuning in. I feel like today we've had such a wholesome conversation, and I do believe that you've gotten something from it. But you know that hatuwezi maliza before we get the pointers, or rather just to run through what we've done right from 8. And Mumbi will be helping us do that, so that if you just joined us right now, or you joined us a few minutes ago, we'd be able to, you know, just go through what we've been able to talk about since we started. But before we do that, is a thank you so much for coming. Thank you so much for having this conversation with us, and it has been amazing. What would be your parting shot? As you say, tumesalamu, you know. Yeah,
tumesalamu.
But what would be your parting shot?
I just want to say thank you for everyone who's tuned in. I really am grateful. Thank you to you. Thank you to MBCI. They hosted me overnight. I'm really grateful. Oh God, I'm so grateful. And for me, it would be for everyone to take care of their health, whether you're a man, whether you're a woman, whether it's a child. Just take care of your health, because we have been brought to this world for a purpose, a God-ordained purpose. And the only thing that allows us to function in this earth is this body. So the longer we give it, whether the longevity we give our bodies is the longevity we can fulfill our purpose. So when we think about it that way, if you were to be the person to build, let's say, a conglomerate, or you're the one who was to solve HIV and AIDS, or cancer, or just the water problems or the sewage issues we see on the road, but you're sick, are you going to focus on the sickness, or are you going to focus on the water issues? Of course you'll focus on your sickness. So let's not allow the devil to attack our bodies, and sometimes we blame him unnecessarily, because he's not with us as we are gluttoning through 1,000,001 foods, or the reverse, that we're not eating at all. So let's be champions of our own health, and to allow God to use us to solve the many issues that are there, and just to thank God every day, because He's allowed us to be here. So I'm really grateful, and God bless you.
Amen. Amen. Perfect. So thank you so much for coming. That's said and done. Today we've been having Dr. Jemimah Kariuki of Wheels for Life, and she has a lot of heart. She's currently working at Mpisha Hospital. As you get this, you'll be able to know more about her. But she has a vast experience in what she does. So she's the right person to just get to help you and take you through exactly what you do. So for now, let's get segment. As we get the Did You Know segment, you get to, drag your mind kidogo and relax kidogo from the conversation that we've had, and we are able to get into this particular session later with the amazing lady who is Sarah Mombi. Na leo nataka kutumia Mombi. It's Mombi, what the other name? The last one? Kariuki. Mombi Kariuki. Ladies really love using their surname, because as you can see, Dr. Jemimah is also Dr. Jemimah Kariuki. Yeah? Okay, let's take a look at the Did you know segment as we get into this particular run through of what we've done today. Did you know that the human stomach can dissolve razor blades? Hii mkwe tu serious. Hata kama tumeambiwa tuko na acid kwa tumbo, it's not that serious. Doc, can the human body dissolve razor blades? It can? Oh really? Wow. Doc, I confirm it can. It can. That's very interesting. Did you know that?
No, I did not know that.
Yeah.
But the stomach is very acidic, as we've been told.
Yeah.
So there's a possibility that
acidic enough to dissolve razor blades. That's actual metal.
Yes, but it's so thin, so you can break it with your finger. So over time,
but dissolving
over time, the acid can dissolve the razor blade.
Yeah.
Yeah.
Okay. How are you doing?
I am amazing.
Happy and blessed?
Very blessed.
Do you want to touch the book?
Oh,
let us out.
It's such a beautiful book.
Yeah.
It looks very feminine, by the way.
Yeah.
I love it.
Very.
What your body has been trying to tell you.
And no one ever explains.
Buy the book, so that you know what your body has been trying to tell you.
Yeah.
Yes.
So that you'll have someone who'll explain.
Yes.
You see? Amazing.
You can also buy it for your friend, your sister, your wife. You know, there's so many females around you that you can buy the book for.
Yeah.
Yeah.
Perfect. So we keep saying the other time we always start conversations
without introducing
you.
Right. So
please introduce yourself.
Thank you.
Yeah.
Hello everyone. My name is Mombi Kariuki. Some people call me Sarah, but I use Mombi Kariuki all the time.
Yeah.
And welcome to this wonderful segment where we just do a small recap on what we've been talking about during the whole show.
Yeah.
Yeah.
Perfect. Please take us through.
Yeah, so today we did maternal health and we ventured into UTI and yeast infection.
Yeah.
And we have learnt a lot. We have learnt a lot. And during this recap now, tutaendelea kufinyilia vizuri so that usisahau what we have learned. Yeah. So the first pointer today is maternal health is the overall health and well-being of a woman before, during and after pregnancy. And for the past 4 weeks, I think we've been talking about maternal health.
Yeah.
It's been a series.
Yeah.
So if you're out there and you know you're planning on having children, just go on our YouTube, MBCI TV official, uangalie, you know, for the past 4 weeks so that you learn. Yes. So maternal health is not just about the baby, it's about the mother. How is your heart? You know, do you have any underlying conditions? How are your body organs? Yes. So another pointer that we have is UTI is an infection that affects the urinary system and is mostly caused by bacteria from the rectal system. Yes. So women are encouraged, specifically women, to wipe from front to back. Because the bacteria that causes UTIs is from the behind part of the, you know, of the system. So wajibika, and then
wajibika.
Also, and also Akumalizia, she's talked about taking your health as a personal initiative. Like our bodies are the temple of the Holy Spirit. You know, what are you doing to steward your body? Because when people talk about their bodies being the temple of the Holy Spirit, they talk about it from a serving perspective, where I use my body to serve God. But as she has also said, you cannot serve if you're
sick.
Exactly. So
you need
take care of yourself. It's a mandate to take care of your health. Yes. So another pointer that we have is some of the symptoms include burning pain while urinating, dark colored urine. So if you have these symptoms, seek medical advice. To remember, we should, from the healthy living segment, that we should stop self-medicating. Yes. So if you feel like there's something that's wrong with your body, go and see a doctor. Go and see a health professional. Akwambie what this is exactly. Because the human body is very interesting. You might have a symptom for one thing, but that's not what you're suffering from.
True.
Unaenda unapata unaambiwa
something totally different.
Something totally different, and you just wanted to go and take, you know, over-the-counter drugs. Yes. Okay. So another pointer that we have is yeast infection is caused by yeast overgrowth. So our body, we naturally have yeast, but now when it overgrows, that's when you have the yeast infection. And it is characterized by cheese-like discharge accompanied by itching and irritation. So again, ukipata hizi symptoms, go to the doctor. Usijitibu.
Go and get help.
Go and get help.
You know, I've learned today about the pH changes that happen in our body. And it's very interesting that taking antibiotics can actually cause yeast infections, because you don't talk about that enough. We just talk about, you know, ukikunywa antibiotics, lazima umalize antimicrobial resistance. But we don't talk about the side effects
of taking. You know?
And what you're supposed to do after that. So I think it's very interesting that our bodies, God did a good job.
Master planner.
That he did a good job.
Did an amazing job.
Okay.
So the next pointer that we have is other risks. Okay, no, it is characterized by cheese-like discharge accompanied by itching and irritation. We've talked about that. And other risk factors include poor hygiene, holding urine for too long, and dehydration. I didn't know about the holding urine for too long. You mean that if you hold your urine for too long,
you're going to get UTI?
Oh my God, I did not know that. Because the bacteria is in the urine, and if you keep it for too long, you are keeping the bacteria. And also when you grow,
because it's a living
thing, and it multiplies, and then you get sick. Like, it's self-inflicted sickness. So you know, I just like that every day we are learning and we are growing. And you know, it's just these small things. Now they build this huge body of knowledge.
And mostly we talk about UTIs and we blame poor hygiene. Lazima ni a public toilet. But we have so many causes. As you highlighted the three of them, is that you have to take care of your body. Don't hold urine for so long. Also to remember what you're supposed to do if you're going to a public toilet.
Kwanza buy the sanitizer in a spray bottle so that you can, you know, you can spray and squeezy. after COVID, they are very, very affordable.
Yeah.
Very affordable.
Also the part of flushing the toilet.
Before.
Wow. Also, while flushing after, use a tissue. Okay, before and after.
Yeah.
Use a tissue to hold, because that is the same handle that everyone
is using. And I never thought about it.
Who would have thought?
I just thought the bacteria is in the toilet seat. Just don't touch it.
Yeah.
But now I know that there's more. Yes, every day we learn and we grow.
We need to take care of ourselves.
Yeah, and we've also talked about menopause, exercise.
Or to be a woman.
Exercise, yes, and also sugar.
Yeah.
I have a friend who's very disciplined when it comes to sugar.
Sugar part. The sugar. I'm telling you, you're having a very good conversation until she mentioned about sugar. And everything in my life dropped, and I felt like I need a lot of help.
Yeah.
Because what?
You know, just not only feeds yeast, it also feeds cancer. Yeah. It feeds so many other things.
Diabetes.
Yeah, and diabetes. So regulate your sugar intake.
Do you have other people who struggle with taking a lot of sugar like Mary? Is it just me?
There are many people out there.
Yeah.
But then also, you can just discipline yourself. See that you don't take sugar, but just take it, like regulate the intake.
Because I feel like we always need acha nijitete. Daktari, wacha nijitete. I feel like sometimes you need energy. Energy to do a lot of stuff. So sometimes you
want to pick sugar.
Lazima ukue umekula. Like eat well. Eat well. Also not eating is a problem.
And then when you don't eat, you get cravings.
Yeah. So, but most of the time we need quick sugar. We need quick sugar. You need to be active. You need to do this and do that. But as Doc has said, watch out after excuses.
Yes.
Regulate.
Wajibika.
Wajibika is going to be our word for this show. So that has been it for this particular show that we've had. And maybe just to repeat is that we have an amazing book right here that will explain everything that we've talked about. It's very important for you to just talk about your health, to know everything that's going on in your body, so that your body won't be a stranger to you. If anything happens, you understand what's happening. At Talking Hospitali, you know what you're treating. It's easier than using, Dr. Google, Dr. ChatGPT. It's very important for us to know what's going on in our body. So if you need this, you can always be able to get it. We've given our till numbers. So order one for yourself, order one for your sister, order one for your friend, your wife. It's going to be very important. All right. So that's it and done. Thank you so much for taking us through that session.
You're welcome.
That has been really amazing.
You're welcome.
It's such a beautiful Wednesday today.
Yeah.
And I pray that everything you get to touch prospers. I pray that everything that you're planning to do today will be successful. Yeah, but also not only today, but also the rest of the week, because it's just Wednesday.
It's just Wednesday.
Yeah, so I pray that this week will be amazing. Yesterday I thought today was Friday. Funny enough.
Yesterday was Tuesday, the second day of the week. Wow.
I know.
Wow.
I know. So it's just Wednesday. So I pray that your week will be blessed in Jesus' name.
Amen.
We're having lunch hours.
Yes.
What time to what time?
From 12:30 to 2:30 p.m. Make sure you tune in. Let's worship together.
Yeah.
Let's listen to the word together and grow together in the spiritual journey.
Yeah. Perfect. Wish them an amazing week.
I wish you guys an amazing week ahead, full of blessings.
Amen.
May the Lord favor you and may He bless you.
Amen.
May He be the light upon your path.
Amen.
In the name of Jesus.
Amen.
Amen. And continue tuning in to our TV station and also our radio, which is also in Nairobi now.
Yeah. Amazing. Perfect. Thank you so much for that. Do have an amazing rest of the day and rest of the week, and we will see you next Wednesday. Yes, but until then, God bless you. God be with you. Have an amazing rest of the week. Before we leave, next Wednesday we're having an amazing discussion.
Yeah.
We're talking about medical imaging. Yes.
Quite an interesting topic.
Yeah.
And you guys will learn a lot.
Yeah.
A lot.
So do not miss out.
Mind-opening.
Yeah. What is one of the things that you'd want to know about medical imaging?
Different types of medical imaging. Like why are we using this type of medical imaging and not this other type?
Yeah.
Like what makes doctors choose this type and not this other type? Why are we going for a CT scan? Why are we not doing an X-ray? Why are we using an ultrasound? Are there different types of ultrasounds? Yes, I'm very, very eager.
Okay.
Yeah.
Perfect. So that is what we'll be doing next week. So do not miss out. Same day, same time, just next week.
Yes.
Yeah. So do not miss out. That's it, Ndandu. Have an amazing rest of the week. God bless you. My name is Rachel Kahuku.
And my name is Jemimah Kariuki.
Bye-bye.
Bye-bye.